Hey guys, it's Jeanette. Hope you guys are doing well. It is Thursday the 18th. I had my clinical day 3, so I have a list of things to talk about. First, clinical day 2 last week was a lot better than clinical day 1. I kind of took more of an initiative to do things and not really rely so much on the nurse. The first week we were just shadowing nurse, and the second week was to pick a patient and kind of stick with that patient for the entire day. It was a little difficult for me, just having one patient. It was just, I felt like I should be doing more. But other than that, my patient was great. My patient was in a status where she's able to, she knows her body well and she's able to verbalize whatever she needs. But just because they can do that doesn't mean you should not do your job. And I came across a situation that I felt could have been prevented if people were doing the jobs and documenting accurately. And so that really bothered me from week 2. But yeah, I mean, just, cover yourself. Obviously, put the patient first. Do your job. Although the patient may say, oh, I'm feeling well, I'm good, whatever. Still assess, and don't take, I've learned not to take, just kind of, I don't know. But let's just say there were a series of vital signs that I did not agree with, and it was kind of a big deal. So just because someone else is taking the vital signs or documenting and it doesn't line up with what I'm doing, I have a problem with that. That means someone else isn't checking or whatever. So yeah, and also trust your instinct. You will probably be put in situations where you may recall the right steps to do, the right things to do, but your patient's safety is number 1. And if you're in a position and you need to do something for their best interest, I say do it. And I won't go any more into that, but yeah, that's that. Okay, so simulation 1, like I said, I had 2 simulations in one day. One was on a diabetic person who had a DKA crisis, and the second was a sickle cell patient who had a sickle cell crisis. So it was interesting. I mentioned before, the dean or the director of nursing watched me and my group do the sickle cell one, and she was really impressed. So it was nice to hear that. Man, your nerves could get to you, and you probably say things that you never planned to say. It's different. So try to do a lot of role playing, especially the different roles for that. What else? And it's just funny, like, I got to the sickle cell simulation and I'm talking and I totally blanked out on the the patient's age and stuff like that, and I was like, oh, what are you here for? Totally forgot sickle cell, and it's just the nerves. But other than that, it went really well. I got full points on that. Let's talk about Med-Surg exam 1. I took it yesterday and I'm still like going through like denial, and I'm just so sad. I got a 76 and then I got 2 extra points, so I got a 78, and that's nowhere near how I normally perform. So that was just a hard pill to swallow. Going into this exam, I was doing everything I could to prevent getting the score that I got, knowing how important the points are for this class. As you know, 75%, you have to have that. If you have below 75, you fail the class. So I never anticipated getting a grade in the 70s. And I say that not because, what I know, whatever, but just for my preparation. I am a person who really, really strongly believes preparation is key. What you put in is what you get out of things. So I did a lot, and that may have been the problem. So right now, I talked to my teacher today during clinical, and I almost like started crying because it's just so disappointing to just work so hard and then you get a grade like that. You know, it's definitely, and it's the first exam, so it makes you kind of anxious for the upcoming exam, and it becomes a numbers game, and that's just really, it's really sad. And I just feel like it's like a cloud over my head, you know, unless like I feel like I won't feel any better until I have like exam 2 and like I get, you know, something in the 80s or something, you know, because it for me it'll kind of clear me from that hole that I won't be able to dig myself out of. It is nice to hear the teachers like, oh yeah, Jeanette, you're gonna be fine, don't worry, you know, it's great, but things can always happen, you know. Anyways, I'm still dealing with that. Let's see. So my study strategy, let's just talk about, I mean, I did maybe a quarter or half of the objectives. I read like the tables in the books. I did practice questions, not as many, because when I was doing them, they weren't really lining up with what we were learning, and I just felt really discouraged. I taught it to people. I did my sticky note stuff. I did concept mapping. So it's like I did all these things that were supposedly going to help me, and I just don't know what happened during the exam. Well, I do know what happened in the exam. So I don't know, I just feel like all that hard work, like I feel like I know a lot. Like, I feel like I know a lot. But it just, part of it is like, well, at least you know a lot, and like obviously you'll be more prepared for NCLEX, but then the other part is like, right now, all that matters is the exams, you know? Do I pass? Anyways, I passed, so I need to be happy about that, but it's still, because it's freaking me out that I have a way of studying that I've been successful with. You know, I've taken the teacher's advice, I've looked into the resources that they have recommended, and it just did not play out well. So I'm still going through that, but my teacher and I spoke today, and I'm going to meet with her hopefully Monday and kind of review the questions that I missed. And I don't think it's one particular area, so I don't think it's a knowledge deficit. I'm sure it's maybe an application issue or something. So I'm hoping I know more about it on Monday. We also have exam review Monday, and I honestly hate exam reviews. I think it's kind of like kicking myself in the face all over again. So I normally don't do well sitting there listening to the teacher go by one on the rationale or the thinking. I just feel, I don't know, I just kind of shut down, so I don't really get anything out of it. And I'm hoping the one-on-one I will. So I don't know if I can skip that, maybe I will. Yeah. Okay. So this time around, they told me to use a blank note card, like an index card, and cover up all my answers and review the question and kind of think of an answer that I would think, you know, that answered that question, and see from my 4 choices which one is closest to that. I'm probably going to try that. She told me not to rewrite notes. I don't know how I feel about that, but maybe I won't do that. And this time around, I mean, I only changed one answer. You know how they're like, just go with your gut. I went with my gut. And I only changed one answer, which I think I changed it to the correct answer. Setting up strategy. I don't know. Okay. And then so clinical day 3 was today. We were in the IMU area. It shares the same space as like the ICU area. I had a good day. My patient was really nice. Definitely knew I was a student and was helpful, and I was just so grateful. The nurse that happened to have that room was very nice too. She, you know, let me follow her and try to do things, and I gave 2 more like insulin injections, and it's really weird using the pen. I don't really know. But yeah, so in one of my visits, a respiratory therapist came in, just really rude. All I asked was trying to get confirmation on the treatment that she was given, and she gave me so much inappropriate responses that I wanted to cuss her out. And like I was in the room and I got like really emotional, really upset, and like I was like kind of like deep breathing, and I'm looking at the patient and he's looking at me like, why is she talking to you like that? And that's the part that really bothers me. If you want to come at me some type of way, if you want to say something, say it at least outside of the patient's room, not indirectly in front of the patient, you know? And secondly, I mean, it wasn't even called for. I mean, the answer would be a yes or a no. I wasn't trying to have a, 20-minute conversation with this lady. So she did that, and that kind of was my last straw. This was before 9 in the morning, and at 7 o'clock when I got on the floor, I think my mom texted me saying that my aunt just passed. So I wasn't even on the floor for a minute without getting that news. So she passed last night. You kind of have to do clinical, you know. My mind was just all over the place, and I'm still getting over the exam scores from yesterday. And it's like, right now when I say you hit that like edge, I guess you just have to cry it out. And this is where like nursing school gets emotional, when people ask me, how do you manage this, how do you manage that? I mean, you do what you can, but when you get to this point, you need to cry it out. So I was talking to my friend, and I explained to her what happened with the respiratory therapist, and she looked at me, she's like, she did the same thing. And our rooms are like next to each other, so she was in her room first and did that. Then she came to my room, and apparently because I asked her that one question, she kind of chewed me out, and I gave her a response that maybe I should not have, but I didn't care. It's so sad. Well, anyways, so after I went and told my friend what had happened, I got so emotional after everything. This is like 9 o'clock in the morning, and I told her I'm going to the lounge, and I'm literally just bawling. And it's like the ugly bawl, like we were talking about, like, do you cry pretty? Do you cry like ugly? I cried to make the noise like that. So it was just like, my eyes are just red, and it was just bad. And the monitor tech was actually in there eating breakfast or something, and he asked me, are you okay? And that's the type of person, the personalities that I like to be around with. As soon as we were on the floor, he was just teaching us. He, brought us to the monitors, kind of explained that, he watches everyone. And it was just nice. And he's like, oh, you should have came to me. I can tell you about everyone's personality. And then I mentioned, I didn't even mention the person's name. He knew right away who I was talking about. So they were having an off day. But that doesn't really give anyone any type of reason to treat us, especially students, like we're nobody, and not even like a decent respect, so that really upsets me. And it's so sad, because the 3 or 4 days I've been there, that has happened. I have met someone in every single floor that just ruins my experience as a student and learning, and I know I have to shut that off. But it's hard. Still emotional, as you can see. So anyway, so that really bummed me out. And then after lunch, I went back and I did my cranial nerves assessment, like my neuro check and all that. And the patient, this is the part that I'm most upset about, he goes and says, she didn't have to talk to you that way. She forgot where she came from. She, at one point, was a student and had to ask questions. And then he goes, you're about to cuss her out, weren't you? And I said, yes, and I apologize that he had to hear that. But don't forget that your patients, they're patients, they're not your friends. They're not like your therapist to listen to. That's not what they're there for. So I feel very strongly about having any type of casual conversation in front of them. Like, I hate when people go in and start talking about their weekend. with someone else in front of the patient, you know? Like, I don't know what it is about that, but it upset me, and he's alert. It's, you know, like, even if it wasn't alert or whatever, don't do that. So that really pissed me off. And then I was, fast forward, I was taking care of another patient, we lead them to their room so they can use a urinal. And that same lady was like, where are you taking him? And I looked at her like she had 5 heads. Like, I had no idea why she would care, why she would ask me. She's a respiratory therapist. You're doing your own stuff. Why are you caring? You know, like, I don't understand that. And I responded. Maybe I could have been better about my attitude, but I think I've just reached my my level. Anyways, let's see. I think that's that. Hope you guys are doing well. It's gonna be an interesting few weeks coming ahead. We start cardio this coming week. It's 3 days of lecture, so I know it's going to be big. And also I will do something different for my study strategy. Before, I used to, in foundations, I used to record my lectures, and I haven't been doing that in mental health. But I talked to my teacher today, and she told me to start doing that. So I'm probably going to record that on Monday and listen to it on my drive. And I'm hoping I can just get over it this weekend and kind of go in fresh. It's just really hard to remove that from your head, you know. Clearing your head after everything is gone, it's hard. Anyways, I think that's it. This is really a downer video, huh? But hope you guys are doing well. Everyone who just started, I know exam 1 should be coming, or maybe you had it. Hopefully that's going well for you guys. If you don't perform well, meet with your teacher. That's what I'm doing. So, like I tell everyone, keep your head up. It's still possible to continue and all that. I'm trying to take my advice. But yeah. Anyways, if you have any questions, leave it in the comments below. Don't forget to comment, like, and subscribe, and share the videos. Bye.